Admission Department today. May I know how to address you?
Good morning, my name is Lim.
Good day, Madam Lim. Before we start, do you know what the purpose for session is today?
Oh, my doctor asked me to come here to look forward for my COPD treatment. How can you help me?
Yes, correct. This counseling session is specifically to help you to enforce the use of Breezhaler for a COPD treatment. It will take around 20 to 30 minutes. Is it okay for you?
Yes, sure.
Alright, thank you so much. So, how are you feeling today?
I'm not feeling quite well these few days because of non-stop coughing and wheezing. This makes me very uncomfortable because I cannot breathe properly, especially at night. I always wake up 2 to 3 times at night because of the shortness of breath and sometimes feeling pressure on my chest.
Oh, I see. That's very unfortunate to hear. Before we start, can I have a look of which type of Breezhaler that you are using? This. Oh, okay. So, we are currently using a Breezhaler under a T-bro and it serves as a controller. Don't worry, I will try my best to help you out. You may also face out any problem throughout this counseling session, yeah?
Alright.
Okay, before we start, did you know what the purpose of using this Breezhaler? What did the doctor tell you about the use of this Breezhaler?
Oh, doctor told me this inhaler can help to relieve COPD symptoms like cough or sneeze so that I can breathe more easily.
Yes, you are correct. May I ask, did you take your Breezhaler today?
No, because actually I have some doubts about the modern medicine. Can this small device really help to treat my COPD? My friend told me like ginseng or ginger are better to relieve my symptoms.
Alright, I totally understand your concern. But actually, the traditional herbs such as ginseng or ginger that you stated just now is not the best way to treat your COPD. They may provide some symptom relief, but there is no scientific evidence to prove its efficacy and safety of use. In fact, Breezhaler is an inhaler containing medications specifically designed to improve breathing problems caused by lung disease known as COPD, which makes the muscle around your airway become tightened. So, after the medicine is inhaled, it will relax the muscles around the airway to make it become widened and easier for air to get in and out of the lungs. Thus, breathing difficulties can be relieved.
Oh, I see. Does that mean this inhaler can reduce the effect of COPD more well? So I will not always cough and sneeze and can breathe like normal?
Yes, you are correct. Because COPD is a serious lung issue, the airway might get inflamed and become narrower. For example, if you look at this A4 paper, when I look it up like what airways look like in normal condition, the air can flow through smoothly. But if it is inflamed and becomes tight due to COPD like this, the air will become difficult to get in and out, thus causing you shortness of breath. There will also be excess mucus than usual in the airway, so it makes you non-stop coughing or wheezing. So far, did you understand what I've explained till now?
So far so good. I'm just curious about this Breezhaler and how the medication helps to improve my condition.
Okay, so now I will explain more about the vertebral Breezhaler device. In this set of devices, we'll get an inhaler with cap and blister pack of hard capsules containing two active ingredients, which are indacaterol and glycopyrronium. Both medicines are bronchodilator, which help to dilate and widen the airway for easier breathing. The capsule shall be placed into the capsule chambers after taken out from the blister pack. And there's a cap to cover the mouthpiece. The button at both sides of the devices will pierce through the capsule upon pushing on it. It can help to direct your medications contained in the capsule to your lung, which can help to alleviate your COPD condition. With more airflow enter the lungs, what do you think about the oxygen level in your blood? Would it increase or decrease eventually?
I think it should be increased if more air enter, am I right?
Yes, you are right. I'm glad that you are able to understand so far. Your blood oxygen level will increase and maintain at a normal level with more fresh air enter the lungs. Thus, the problems such as shortness of breath, confusion, or restlessness could be relieved effectively.
Okay, now I understand how this Breezhaler can help for my COPD and make me breathe easily. But why am I still experiencing all these symptoms after taking this Breezhaler?
Supposedly, it will help to improve your COPD condition. Before we figure out the reason, may I ask the frequency of using Breezhaler except for today?
I only took it when really feeling unwell, like sometimes sudden wake up at night because feeling breathless or keep coughing at work time, which make me annoyed.
Alright, now I understand the problem. This vertebral Breezhaler is used as an ongoing treatment for COPD and not for sudden attack of breathlessness or wheezing. It should be taken once daily and not too risky to reduce the effects of COPD on your daily life. Just now you mentioned that you are having sleeping problems due to breathing difficulties, right?
Yes, that's the most annoying problem I have suffered so far.
Okay, so I will suggest you to use the Breezhaler before bedtime or after dinner every day. This will increase your sleeping quality by reducing COPD effects at night. Thus also improve your working performance during daytime, as you can get enough rest. The wheezing or coughing problems also could be greatly relieved if the excess mucus condition is alleviated.
Oh, So I should take it before going to the sleep every day and on the same time?
Yes, this will greatly help you to remember to use the Breezhaler if you already get used to this routine, so that you will not miss any dose to prevent further worsening COPD. Am I clear so far?
Yes, now I understand the importance of Breezhaler. Thank you for explaining.
That's good. Now, I will tell you how to use this Breezhaler. Before we start, did the doctor tell you about the correct techniques or steps of using this Breezhaler?
Actually, I think the doctor do tell me the procedure to use this Breezhaler, but I think I already forget it. So can you repeat and demonstrate it again?
Sure, I will demonstrate you step by step on how to use this Breezhaler. Before using this Breezhaler, you should wash your hand with soap and water. First, remove the cap of the Breezhaler. Then, tip the mouthpiece to open the inhaler. With dry hands, remove the capsule from blister and place it in the chamber. After that, close the mouthpiece until you hear a click sound. Press side piercing button once and release. Remember, do not pierce the buttons more than once and do not shake the device. Before inhale, you should breathe out the air in lungs completely. Place the mouthpiece between your teeth and close your tips to form a good seal. Next, breathe in rapidly, steadily, and as deep as you can. So, you may feel the vibration of the capsule. Then, hold your breath for about 5 to 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. While holding the breath, remove the inhaler from your mouth and breathe out gently in the direction from the inhaler using your nose. Open the inhaler to see if any powder is left in the capsule. If there is any left over, close the inhaler and repeat the inhalation process. After complete inhalation, open the mouthpiece and discard the empty capsule. Finally, close the inhaler and replace the cap. So far, do you understand about what I'm explaining?
Yes, sure. It's really a detailed step. I also realized that I do not hold the breath after inhalation.
Holding the breath is important so that the medications can deliver to your lungs. Another reminder is that remember to close the inhaler after use. A correct technique is important so that the correct dose can be delivered to reveal your condition.
Okay, thank you for your reminder and I will do it.
You're welcome. Now, would you mind demonstrating how you use this inhaler?
Of course. Please correct me if I'm doing it wrongly.
Sure, take your time.
So, firstly, remove the cap. Hold the base of the inhaler firmly and tilt the mouthpiece to open the inhaler. Then, remove one capsule immediately from the blister. Then, place the capsule inside the chamber and close the inhaler until I hear a click sound. Hold the inhaler upright and press both sides of the button to pierce the capsule once and release. Then, Place the mouthpiece in the mouth and close the lid firmly around the mouthpiece.
You should breathe out the air out of lungs fully before placing the mouthpiece in your mouth.
Oops, sorry, I missed these steps.
No worries, that's okay. You may continue your demonstration.
After breathe out completely, place the mouthpiece in the mouth and seal the lips around the mouthpiece. Breathe in rapidly, steadily, and as deep as possible. Then, remove the inhaler from the mouth and hold the breath for 5 to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and as long as comfortable. While holding the breath, remove the inhaler from the mouth and breathe out through nose. After inhalation is complete, open the mouthpiece and discard the capsule. Then close the inhaler and close the cap.
Well done! So far, you are using the right way of inhaler. Alright, I would like to share you some other precautions when using this inhaler. Firstly, ensure the capsules of a Breezhaler are always kept within the blisters and used immediately after opening it. Kindly ensure your hands are always clean and dry when handling the capsule. Peel the backing away from the blister to open it. Do not try to take the capsule by trying to push it through the foil wrapping. Do not swallow the capsule or use it with other inhalers. Do remember, do not blow air into the mouthpiece as well.
Okay, I will take note about this.
Do you know how to check the remaining dose?
I'm not sure about it.
Okay, this Breezhaler comes with one inhaler together with 13 blister packs, hard capsules. According to physician, you only inhale one capsule each day for 30 days. If there are remaining capsules after 30 days, it indicated that you missed the dose.
Okay, understood. What should I do if I miss a dose?
You may set alarms as reminders to take the medications. If you forget to inhale a dose at the usual time, inhale one as soon as possible that day. Then, inhale the next dose as usual the next day. Do not inhale more than one dose on the same day. Just a quick question, may I know how you store your medication and dispose it?
I always put my inhaler and capsule in a basket above the refrigerator. For the expired medication, I just threw them in the dustbin.
Okay, let me share with you the proper ways of storing and disposing your Breezhaler. Do not store them above 25 degrees Celsius and avoid placing them near hot appliances or sink. Next, store the capsule in the original blister to protect from moisture and do not remove until immediately before use. Do not use the medication if you notice that the pack is damaged or shows signs of tampering. Keep them out of reach of children as well. Lastly, do not use the medicine after the expiry date on the blister by referring to the date after expired (EXP). Do remember, each inhaler should be disposed of after all capsules have been used. Meanwhile, for medication disposal, kindly bring your expired medicine to nearby pharmacy and refer to pharmacists about how to dispose them if you are no longer used. It can protect the environment from being polluted.
Oh, I see. I should store my medication in cardboard instead of placing them above the refrigerator. I promise not to throw the expired medicine as how waste anymore.
Great. Alright, let me have a quick check. Can you share with me how you plan to clean your inhaler after using it?
Sure, I plan to wipe the mouthpiece inside and outside with a clean, dry, lint-free cloth to remove any powder residue. Am I doing it correctly?
Yes, exactly. Do keep the inhaler dry and never wash it under tapping water. Now, I would like to share with you regarding the potential side effects from using this medication. However, not everyone will experience this side effect. I am telling you now so that you will be aware of these symptoms and know how to manage them.
What? Side effect? Will it harm to my body or I should stop to take the medication if it has side effects?
Calm down. Every medication has its own side effect. It will not harm your body. The side effects are divided into common side effects and serious side effects. For common side effects, you may have blocked nose, sneezing, cough, headache, sore throat, or fever. Typically, the symptoms will relieve in a short time, But if the symptoms are persistent and getting severe, kindly consult a doctor or any healthcare provider immediately. Meanwhile, for serious side effects, you may have difficulty breathing or swallowing, swelling of tongue or face, skin rash, which indicated that you are having allergic reaction. If you are experiencing this, please stop the medication and consult doctor immediately.
Okay, thank you for the clarification. Does it mean that I cannot stop taking the medication whenever I wish unless there is the presence of serious side effects?
Yes, exactly. Please do not stop the medication on your own. Always remember to consult your doctor first, as the inhaler is vital in treating your COPD.
Okay, I will keep that in mind.
Okay, let's proceed with another question. How would you know you are getting the right dose?
Is it that I should take 1 capsule a day?
Yes, you are right. You should take only 1 capsule once a day, as it is effective for 24 hours. Kindly take it at the same time daily to increase your medication adherence. To check for having a complete dose, you may open the inhaler and notice is there any powder remaining in the capsule. If there is powder left in the capsule, close the inhaler and inhale for a second time.
Okay, I will try my best to adhere to this medication. Hopefully, it works well for my COPD.
Alright, before we end up this session, any question for me?
Yes, I would like to ask, is it normal if I cough after inhaling?
No worries, this may happen. Our body shows normal reaction by expelling foreign particles out of airway, as long as the capsule is empty and you hold your breath for at least 5 to 10 seconds. You have received full dose of your medication.
Oh, I see. Thank you for the information. I got another question. How can I reduce the chance of exacerbating the COPD?
Good question. Firstly, you should not smoke cigarette or vape. The chemical substances in cigarettes will narrow your lung airways, worsening the COPD condition. Next, reduce exposure to dust and extremely cold place. If you cannot avoid it, you should wear a face mask. The most important is always adhere to the medications and never skip any dose.
Okay, thank you for your explanation, and I have no question right now. I gained a lot of information and knowledge today.
Alright, it's already time to end up the session today. Thank you for your time, and do visit us if you have any inquiries. Before you leave, here's a simple information leaflet about the steps of using the Breezhaler.
Oh, thank you so much.
You are welcome. Bye.
Bye.